Good morning.
Good.
I'm I am Liz Baxter. I'm the CEO of the North Sound Accountable Community of Health, or the North Sound ACH. I use she, her pronouns, and I'm currently coming to you from the traditional homelands of the Lummi and Nooksack peoples. I am honored to be moderating this morning's panel, which is focused on the impact and lessons learned so far from the COVID pandemic. Before we get started, I have a couple of Zoom reminders for you. The audience is muted and your videos are all turned off, so you should only be seeing the panelists on your screen. And at the bottom of your screen, you should see both a chat and a QA functions. If you have technology issues, please put it in the chat box. It's only for that purpose, and our tech team will see your chats and get back to you individually, also via the chat box. And if you have questions for speakers, use the Q&A box. And as we go through the session, we will do our best to get to as many questions as possible. We are recording all of the sessions over the 3 days, and copies of any slides that are used during the sessions will be available at www.washingtonach.org after the third day of the symposium. So we'll get started. We have all been dealing with COVID in a variety of ways as employers, as work colleagues, planners, policymakers, community members. No one has been untouched, and we have learned a lot about how effective or ineffective we are at emergency response over extended periods of time. And we've also learned how to manage inequitable access to services, testing, vaccine, and other things. It has led to new partnerships, some explicit investment in changing strategies. And I am joined by three panelists who are each going to share some of their stories about what's been happening around COVID from three different regions of the state. So the panelists are Leslie Naramore from Washington Gorge Action Programs, who will talk about their partnership with Southwest Washington ACH, or SWATCH. Marguerite Rowe from Seattle King County Public Health, who will share their experience working with Healthier Here. And KJ January will share the work from Spectrum Center Spokane and some work that they've done with Better Health Together. We're going to post each of their bios in the chat, so you can get straight to hearing from them without me having to necessarily read those bios out loud. And I have the job of trying to help us stay on time and on track, and my colleagues know that sometimes that's harder for me than for anybody else. So I'm going to be reminding panelists if we need to when we've got about 1 minute left to finish up the presentation. So Leslie, would you mind kind of jumping us off and just talking about your work with SWATCH and what it looks like to be doing work around COVID from your part of the state, and maybe even starting by describing where you are in the region that you're working in.
Absolutely. Thank you. So I'm Leslie Naramore, and I am the Executive Director at Washington Gorge Action Programs, which is the community action agency for Klickitat and Skamania counties. So that's all the way at the bottom of the state along the Columbia River in the Columbia River Gorge. And I want to share with you today about our partnership with our local accountable community of health, which is SWATCH, on the COVID CARES program. And this is a program that provides assistance in the form of both monetary assistance and deliveries to people who are quarantined due to COVID-19. So it provides rent and utility assistance if the person needs that help while they're quarantined due to not being able to work, and then groceries as well. And Klickitat and Skamania counties are very rural. If you've ever visited the gorge, you probably know that. We do not have any grocery deliveries. Restaurant deliveries are very, very limited and very expensive. And many areas in our counties don't have cell service. and internet access can also be limited. So the CARES program for us has been absolutely invaluable to our area. And I don't think that it's an exaggeration to say that this program has saved lives, because I don't know how we would have been able to accomplish any of this without that partnership. We have provided grocery delivery services, medication delivery, rent and utility assistance, and then daily check-ins, which to me is huge, because being in quarantine is very lonely. And when you're already in a rural area and then you're stuck at home and maybe you don't have cell phone service, maybe you don't have internet, having someone who can call you once a day, check in, make sure that you're doing okay, and just be that personal connection for you is such a unique and much needed thing. And I do just want to highlight that Swatch has just been an absolutely fantastic partner through this process. They've helped us conquer obstacles that we face as a rural community, and they've helped us work on partnerships with grocery stores who had never offered curbside and pickup options. And I want to share a story with you today that one of our community health workers, Samantha, shared with me. And she tells me that one afternoon, I received a call from Senior Services in Goldendale. I was informed by the agency that they had a very special client that needed assistance. Little did I know that this would be the most memorable client I have served in this county. She is an elderly woman that got COVID-19, and she is a fighter. She's a strong, independent, and intelligent woman who just needed a little bit of extra help. And during the time that I worked with her, I was able to get fresh food for the household and essential items that were in need. I was also able to pay the household bills for the client and apply for additional energy assistance for the client. And what makes this person so memorable to me is that she always showed appreciation for what I was willing to do for her. And this is the part to me that is that human touch that you can't beat. This client uses a walker, and thus I had to make sure that she was able to get everything into the house properly, because the deliveries had to be no contact. So I made sure that the bags were not too heavy for her to lift so that she could get everything into her house by herself. This might seem like a small gesture, but to her, it was a big deal. She knew and I knew what needed to be done so that she could get the items into her home safely with no questions asked. It has now been a little over 3 weeks since I worked with this client, and each Friday she calls me to check on me. Sam says, "This is why I do the work that I do." And I wanted to share that story with you because I think so often we get hung up on numbers and performance measures and outcomes, and those are all really important things, but I don't want us to forget the why, the why we're doing this work. It's that personal touch, it's the lives that we're changing. And for me, that's what keeps me committed to this work. So thank you all for having me here today.
Hey, Leslie, can I ask you just two quick questions? If you can describe what the CARES program is, and, just because you described your two counties as really rural, like what's the metropolitan area that folks in your two counties would be heading to if they needed to head somewhere for major services?
Sure. So the CARES program is a program that came down through the Department of Health to Swatch, and then Swatch partnered with community-based organizations to get the work done. And it's a program that while you are in quarantine, you can receive rental assistance, utility assistance, grocery deliveries, and daily check-ins. So it's providing all of those services that are going to be really essential while you're isolated. And as far as the I mean, if you can even call it that. So we are right on the border with Oregon and Washington. So depending where you are, if you're in Skamania County, you're probably going to Vancouver, Washington. If you're in Klickitat County, you're probably going to Hood River or the Dalles, maybe Yakima. But we don't really have large grocery stores or large shopping areas in our two counties. We travel to those places.
Awesome. Thank you for just kind of giving us a sense of place there.
Absolutely.
Marguerite, do you want to go next and just talk about some of the work that you all have been doing and the impact of COVID?
Sure, happy to do so. And hello, everybody. I'm Marguerite Rowe. I'm the Chief of Assessment and Director of Chronic Disease and Injury Prevention at Public Health Seattle King County, and a longtime partner actually with Healthier Here. And just wanted to share a little bit about what we've done over COVID and to talk about why it was really important for us as a public health department to have a partner like Healthier Here, one of our accountable communities of health. So, right, if we go back 18 months or more now, increasing in time, it became really apparent that there were huge disparities in COVID rates among our racial and ethnic groups, and that there was a lot of misinformation, disinformation, and just a need for us to really think about how are we going to turn the tide, so to speak. And part of that was really through working in community partnership. Healthier Here was a natural partner for us. And part of that reason was the work that they had done on the community grants that were part of the Medicaid transformation project that they've been working on. Also, their work in terms of standing up a Consumer and Community Voices Committee and an Indigenous Nations Committee. And so they were a natural partner. They certainly weren't the only partner, but they were a major partner. So together, partnering with Healthier Here, we were able to get some private funds to do an education and outreach project. And in doing that education and outreach project, Healthier Here engaged 32 of their community-based organizations to work with us on an education and outreach project that was designed and guided by an advisory group of community-based organizations to ensure that to the extent possible, it could be community-led. What I would say about that is one of the other reasons why it worked so well is part of Healthier Here's work and part of the work that I've been doing with my group, in particular our evaluation team, is making sure that we actually have staff who are from the communities that we want to impact. And having staff who can quickly develop trust amongst each other so that we can be working together as sort of one unit. I'll just say that as a result of the work that we were able to do about answering questions, getting information, resourcing the community groups to go out and do education and outreach, and leveraging the PPE supplies that the Healthcare Authority had made available to the ACHs. At the end of the day, this project reached over 58,000 individuals in King County. There were about 23,000 people who received PPE. So I'll just say that it was in my eyes, and we built a participatory evaluation process into this project. And that was really important because we wanted to be, at the end of the day, we wanted to demonstrate that these kinds of partnerships matter and that in fact they should be supported, not only to address the issues of COVID testing at that time, but clearly as we move into vaccinations and now as we're doing boosters and we're working on childhood vaccination. So the question is, how do we sustain these partnerships and the good work and continue to leverage them? There's a lot that can be shared about this project, but let me just leave it at that and we'll answer questions as we go through the discussion.
Great. And just because I think when we started, somebody said we might have people from around the country. So do you want to just do 2 sentences on King County and its population?
Sure, King County.
I'm not gonna ask you what the major metropolitan center is, but
okay. King County, we serve about 2.3 million people. And I will say it's one of the most diverse parts of the state. The I-5 corridor runs through it. It is a hub as well for immigrants and now refugees coming in. So it lends to a very rich, extremely diverse population that also has dealing with historical legacies of racism.
Great. Thank you, Marguerite, for that intro. So KJ, do you want to talk about some of your work in Spokane?
I do, and I actually do have a PowerPoint to share.
Oh, gosh.
As we did, I know, I'm sorry, it was last minute, but we have some pictures I wanted to share of our clinic that we did. So I'm going to turn off my video just in case the Wi-Fi messes up and begin sharing.
Okay, there we go.
Yeah, sorry. All right, we still good?
Yep, we can
All
see
right.
him.
Awesome. Okay, so with the funding we received from Behavioral Health Together, we were able to host Pride Popsicles and Pokes, which consisted of 2 large vaccine clinics in June and 1 smaller follow-up clinic in July. Our goal was to not only protect our community, but to celebrate queer health and resilience. We hosted the events in partnership with, we had a lot of moving pieces. Range Mobile Clinics, Spokane Pride, the Asian Pacific Islander Coalition, which I'll refer to as APIC moving forward. We worked with Spokane Regional Health District, Spokane AIDS Network, and the Tenants Union to offer free STI testings, provide rental assistance, and give away free boxes of food. We administered 472 total vaccines, 702 popsicles, and additionally, we helped attendees sign up for other clinics. So here at Spectrum, we know that change only happens when we work together. This wasn't an if you build it, they will come kind of situation. It was people power coming together in community that made these clinics so successful. Coming from a community that is normally left out, we wanted to use this funding in ways that could loop in like-minded organizations, uplift disenfranchised community members, and vaccinate as many people as possible. So how did we get all this? How did we pull all this together? First, we had to acknowledge that individuals from marginalized communities can sometimes be slow to trust, and for good reason. So we had to be intentional with our outreach. Oftentimes, hearing and seeing things promoted by trusted community members and in trusted establishments tends to help dissipate some of the concerns many have. Therefore, we created street teams made up of Spectrum staff and APIC folks that we paid to engage in direct outreach to register community members around Spokane. This included working directly with healthcare providers that work with LGBTQIA2S+ people, connecting with school gay straight alliances and other queer organizations. These street teams also went door to door, talking to businesses, faith groups, and students on the streets. These small teams were crucial for getting reluctant community members signed up for vaccines. By working together, we were able to hand out over 2,000 flyers. We also advertised and promoted this event on various different news outlets like The Spokesman, the Inlander, of course, and also the Black Lens, which is a local Black newspaper. We are also an intergenerational organization, so we wanted to engage the youth and young adults by creating eye-catching social media posts, like the one quoting the Lil Nas X song that dropped this summer, Call Me By Your Name. Right here, you can see these were the 2 Pride and Popsicle advertisements were in newspapers. Those are URLs to sign up for not only the clinic, but also a survey that I'll tell you about a little bit more when we go on. In our outreach, we also focused on paying queer and trans BIPOC artists like Freddie Throne, the person who designed this poster, to create art and marketing materials for posters, stickers, flyers, and additional social media. Oh yeah, there's that. And, oh wait, hold on. And then next, behavioral health worked with our COVID community health worker, King, to create a really awesome video that aired on television explaining why they got the vaccine. Hopefully that plays. tragic. I'm sorry. It was playing earlier. I'll just go on, but our COVID community health worker gave a great expression about why he got vaccinated, why his family members got vaccinated, and why it was really just community members and friends and allies that eased the stress of getting and all that jazz. Terribly sorry about that. So now that we got their attention, we wanted to ease, or now that we got their attention, we wanted to ease the tension to take the focus off the uncomfortableness of receiving a shot. Like I previously stated, we wanted these clinics to be a celebration of life. This is the queer community's second pandemic where a mysterious illness is isolating them and killing their loved ones. So we wanted to honor that by creating an environment that promoted community and queer joy. Therefore, we included entertainment. We played a multitude of singers, dancers, and Drunch, which is a local duo who run a podcast, to aid in the celebratory tone, which made the overall process more enjoyable for attendees and volunteers. On this slide, you can see our wonderful Eggie Sue, who was monumental help in getting the community members feel safe and welcome. This was particularly important for the transgender and non-gender conforming patients that are oftentimes reluctant to get vaccinated and go to traditional healthcare settings due to often being dead named and or experiencing trans antagonistic behavior from healthcare professionals. We had food because food always brings people. We utilized local food trucks to feed people for free after they received their dose of the vaccine, in addition to providing them with free gourmet popsicles to cool them off during the intense heat last summer. And then we also had a makers market, which we advertised across a queer makers market that we advertised across various social media platforms and community organizations. This is where our LGBTQI2S+ artists could sell their art and take home all of their proceeds. We had booths selling paintings, drawings, poetry, and pottery, plants, and even doing tarot card readings. So that was cool. And then lastly, we had swag. Everyone likes swag. We provided a mix of culturally specific and practical health-related items and gift bags, like water bottles, hand sanitizers, stickers, pins, masks. This allowed us to also include information about healthcare navigation, our community survey, and our information about our gender affirming products program for our trans and non-gender conforming community. All right, and hold on. Lastly, I would be remiss to not acknowledge that a large portion of our community is living at or below the poverty line. And talking to many community members prior to planning our event, it became clear that some people had little to no PTO to use to get the shot in the first place, and were reluctant to experience the economic repercussions of potentially missing a couple days of work due to possible side effects. Therefore, we wanted to provide an incentive for community members to attempts to lessen the concerns of missing work. So after each patient got the shot and waited for 15 minutes, received a $50 gift card. Then once they came back for their second shot, they would receive a $25 gift card. And they also had the opportunity to get another $25 gift card for doing our our needs assessment survey that we gave to our healthcare professionals here locally. So potentially they could have gotten $75, which is pretty amazing. While at the clinic, we had booths from the Spokane Tenants Union providing rental assistance, Gonzaga Law Clinic to help with name changes. Spokane Regional Health District did HIV screenings, and Spokane AIDS Network did food boxes. And like I mentioned, the clinic also allowed us to funnel people to additional programs and resources, like getting them connected to our community healthcare workers for healthcare navigation, and our gender affirming products program, which is a really cool program, but not relevant right now. But lastly, I just want to focus on the act of community. It was people coming together and working together to get all members of the community, because it takes all of us. It takes a community to uplift everyone and to save everyone. So I'm going to stop sharing my screen. And I realize I did not introduce myself. So hi, I'm KJ. I'm the Director of Advocacy and Engagement at Spectrum Center Spokane. Terribly sorry, Liz, my fault.
No worries, no worries. And you might see somebody has asked for a link to the video. So maybe at some point we'll just I know it'll be in your slides, but we may be able to share that in the chat box as well.
Thank you.
So I'm going to actually start with you, KJ, because I think that the first question is really like, so what made this work around COVID different? And you've described a lot of how your approach has built on how the community has come together to battle other things that have kind of attacked community members. So what made this work around COVID different?
Well, queer orgs at least aren't really a high priority for funding. And when we do get funding, it's usually niche specific. But by bringing in other people, we were able to broaden the ways that we could help people, and especially ways of dealing with COVID. I know Leslie talked about isolation, and that was a big apparent need here, a lot of reflection time. And so providing resources like the name change or like the tenants union to help with housing, food security, and then bringing in healthcare professionals. It's just all hands on deck, more hands make for light work. And so dealing with all the effects of COVID, we were able to broaden it and trying to be a catch-all, because people aren't trying to go out multiple times and be around groups of people. And so that's what helps, like-minded organizations and building community and bringing what we can to the table.
So Marguerite, when you think about what made this work different, I kind of touch on something you said in your opening remarks about getting information out, but having to battle disinformation and misinformation. And I'm curious if that is something that like public health has had to deal with before. Is there something different about the volume of information that's kind of bombarding people around COVID?
Well, I certainly think that because of social media and technology and the way that people have been connecting, it's really shifted over the last couple of years. And so that really has meant that we need to work harder, smarter, and more tailored, and find those trusted messengers and liaisons who can really help battle some of that information. When we got on the calls, the one thing I will say about our interactions when we brought all the community partners together over the course of this project, and we sat there and we just answered questions. We take every single one, and then we promised if we didn't have the answers, we would come back with the answers. And so trying to be as responsive as possible.
Leslie, what made this work different for you in your region?
Well, I think, being trusted to do the work. And it's so in our region, we have some of the lowest vaccination rates in the state. It's really low, it's rural. There's a ton of misinformation. It's been politicized. And so, it's been really, really hard. But once people find out that, yes, the virus is real, and now I have it and I need help, knowing that we could be there to help them, that we could be there and have some flexibility in how we do that work for them. There are only certain things we can spend the money on, but being able to go out and meet the clients where they are has been just really, really nice to be entrusted to just get the work done.
I'm curious whether, just thinking about this information flow, if this was a unique challenge that, like, what we knew from the science changed. It might change monthly, it might change weekly sometimes, and just Like, was this something that was different, or was this how things have always been? Marguerite, you're laughing. I'm going to go to you.
You know, I think that we are in a unique environment, right? I think the politicization of COVID has been really harmful to our communities at large. And for good or for bad, there's information that you can find. You can Google anything and you can find information. Doesn't mean it's correct. And it's really hard when we're creating messaging as the science is evolving. And so I will say about one of the things that I think about COVID in general is this forced us to work differently, think outside the box, and break patterns that have been slow and potentially really harmful for our communities. And I'll just use one example, is that when the idea first came around us doing this outreach and education project, right? The traditional way that we do these projects is first you start by doing an assessment, right? You do the little you get the data and the community assessment about what's going on, and then you stop and then you go, okay, now let's develop the plan, and then eventually several months later you might do something. We didn't have any time to waste. My our chief medical officer, Dr. Jeff Duchin, was like, no, you need to be out working in community now. And so it was, we're gonna shift the paradigm. We're gonna learn while we work. And we're also gonna fund communities at the forefront and get the funding at them. So it's not that they have to show what they've done and then reimburse them. We knew that communities had been working already, but let's get the dollars out to them so that they can expand and continue to leverage what they already do really well. So lots of paradigm shifts that had to happen in order for us to not only address the media components, but to work and act differently.
So Leslie and then KJ, does that resonate for the two of you in terms of like what made this work different?
Absolutely. I mean, in many ways, it was kind of frustrating because like, why couldn't we have been doing this all along? Like, we all know the work, we know what needs to be done, and we always had all these obstacles in the way. And so now being able to just have the money, get it out the door has been just fabulous, but also frustrating. And I do hope that this will lead to some sort of cultural shift in the way that grantors work with grantees, and that, you know, we shouldn't go back to the way that it was.
KJ, anything you'd want to add?
Nothing that hasn't already been said, basically. I mean, this funding was awesome. Did it lead for structural change here in Spokane? Not necessarily, but it did help us with immediate action that needed to be taken care of, and also connecting communities with other resources that could potentially carry them on after the funding is gone and normal return. I don't know, returns. Sorry.
Normal returns. Is that what you were going to say?
Optimistic.
So KJ, I may just start with you then. When you think about perhaps examples of things that worked well, things that didn't work, like what are some of the lessons learned that you might share with colleagues along the way?
Well, as much as we were very intentional with our advertising for sure, but we also did need to appeal to the majority population, the heterosexuals and the straight or cis white folks in the community who often have kids as well. So we did a wide arrangement of advertising, but that also brought forth protesters, not only anti-vax ones, but also like homophobic folks. So that wasn't great. But through that, we were also able to again, through tragedy builds triumph, we were able to build more connections with the community and strengthen other relationships. That was just something we weren't as prepared as we thought we were for that. Hold on, there's something else. I forgot it. Sorry. But yeah, that's one of the main ones. I might circle back.
Okay, well, jump back in if you think
Okay.
about it.
Thank you.
Leslie, what worked well, what didn't work, and any lessons learned that you can think about?
Sure. I think one of the things that worked well is that this all led to a lot of new partnerships. And that has been just wonderful because especially in a rural community, people tend to get siloed and they're doing their one thing and then you do this thing and then we don't talk. And so having the partnerships that came forth was wonderful. Having the funding to help people who had COVID was wonderful. I think one of the things that didn't work, at least here locally, was that initial messaging of vaccination. And again, it goes back to it getting politicized. And we do have funding now, again, through Swatch, where we're working to do vaccine outreach, which I am very excited about. And I hope that it will help. But that initial, what is it, 20 something months now of living in this pandemic. And we still just have such high vaccine hesitancy. And I just, thinking back, I just wish there had been some way to get ahead of all the negative aspects of and the misinformation, but I still don't know how we would have done that.
KJ, did you think of your thing yet before I go to Marguerite?
Yes, I know I've been harboring on partnerships and community. That's just the big overarching theme, but also using that money and getting it into the hands of queer and trans BIPOC folks and paying them, not just for getting the shot, but like all the background work, all the back end work of being security on staff, setting up, taking down the event, putting out advertisements, creating materials, performers, like all of it was just directly going into these individuals. And it just pushes back on the popular claims that like they're not there, people aren't offering we can't find these folks, but they're out there and they're doing great work, and we just need to give them the opportunity and pay them for their experience, their insight, and their knowledge. And that was the positive. So yeah,
Awesome.
thank you.
Thanks. Marguerite, just thoughts on like what worked well, what didn't work, any lessons learned?
Yeah, I think what worked really well in this instance was actually the flexibility that we had with the funder. And that allowed us to really meet community where they were at, because originally the project was set up around testing. So this initial conceptualization of this project was before we had the first release of the vaccines. And then as we were moving in that first quarter of, I guess, 2021, it quickly became apparent that we needed to talk about vaccinations. And that was where the interest was, and that was where the importance was, because everyone had sort of heard the messages around wear your mask, stay safe, go get tested when you need. So we were able to pivot really quickly. I'll say what hasn't worked to date yet really is a couple things. One is really the sustainability of funding at the levels that I think are really necessary if we really want to make sure that as many people as we can who are willing have the accurate information and can and hopefully get vaccinated, or to know what to do when COVID happens in their lives. The translation of what we've been able to do locally and having that kind of flexibility in the funding and the supporting of the community organizations that KJ and Leslie have been talking about, that is not translating to our federal dollars in an easy manner. And that's a real barrier. And so you know, just as we had this urgency to get out and work in community in a meaningful, authentic way, we also need that urgency to change our systems and to change the way that federal dollars in particular can be used.
Wow, it makes me want to ask a question that I didn't prepare the three of you for, because part of what I'm hearing from you is this notion about investing around COVID. You know, again, it's transactional in a way, whereas we don't necessarily have a commitment to invest in community partnerships, community building, relationship building. But that seems to be like what this one-time infusion of dollars really started to do. So how do we sustain that? I'm just curious if any of the three of you have an idea of how do we sustain that and not lose how important that is? I'd like to see the federal dollars go there, just so I can be on record.
I mean, I mean, I'll jump in, and I think just as we entered into the Medicaid transformation project, right? It was sort of a transformative time. I'll just say that I think there's a huge opportunity right now, right? Because we've seen, and again, I'm based in a health department. It's a public health department. And we've seen what happens when we don't maintain the investment into public health and how long and how hard it is to ramp up. And I think our notions of what it means to create equity, right? To have a more equitable system, one that's focused on prevention and is responsive, and what it actually takes when we have these large scale emergencies, like what it actually takes, and where we should then think about investments of our current dollars and really being deliberate in our policy making and how we shift and transform our systems to say what's at the heart, what really matters. And so much of that is relational, right?
And I would just add, if I may, you know, thinking about, I mean, that's the big question, how do we sustain that? But if you think about all of the dollars that we're pouring into our communities for COVID, and they were targeted towards the people who needed it most, the low income people, the people of color, all of our communities who get overlooked. And if you're thinking about the social determinants of health and whole person care, you know, it's not just COVID, it's housing, it's I mean, it's all the things. So we have to keep those dollars targeted on these things. And like Marguerite was saying, that flexibility, like there's no reason that shouldn't continue. I mean, if we're doing the work, we're seeing the results, I think that it should stand to reason that we have shown that we have the capability and the agency to help our communities and let them make the decisions of what works for them. And that gets back to the equity piece.
KJ, were you going to jump in?
I mean, Leslie took what I was going to say, that housing, food security, like these are healthcare issues, like all of this, it's a whole person kind of thing. So we have, like, there's no reason why we couldn't have been funding or providing aid with this influx of cash. And then also, I don't know, educational trainings also for healthcare workers, so that at least queer and POC folks can go to healthcare professionals that can validate their healthcare needs, validate who they are as a person, listen to their concerns, their concerns about medicine, or like, and not be dismissive of how they're feeling. That's just a little addition.
I want to add one last thing, which is I think what this conversation is bringing out is how do we define what accountability and success looks like, right? Is it the community that's setting those markers of what's meaningful impact, or is it because we've somewhere in a bureaucratic system defined things in a really narrow lens? And you know, we've been at this for almost 2 years. That's also given us a longer time to work together, right? Versus these sort of small projects that start and stop again. And so I think that there is this opportunity for us to again shift and to do what we've learned, that if we're going to make a difference, community has to be centered, right? And it's those communities that are most disenfranchised, most at risk, that we need to center. And if you build the solutions and the systems around those communities, chances are good it will work for everyone, right?
And so as you think, I mean, I'm trying to envision all of the pieces that came into play. So when the pandemic started, our team was required by our COO and epidemiologist that we all take like the FEMA training on how to stand up unified command. And just knowing the structure that gets created in our emergency management systems versus what we're talking about, the need to have that flexibility, to hear from community, to use the resources of community. We have this pandemic that has touched our jobs, kids going to school, people being able to keep working, as well as our health. Like anything that you feel like we should be learning out of the complexity of all the places that this pandemic struck and how it impacted us all, perhaps differently, but sometimes it just impacted us all. Anybody want to go first?
So as we look at transforming our system, I'm going to say that I saw this little catchphrase that I really like, which is equity by design, right? And holding that as a principle and a value for everything that we do. When I think about we also set up our HMAC, our Health Medical Area Command, and so forth. But in addition to doing that, we actually, at least in King County, created an equity response team and set up a community mitigation response team as part of our response, so that it wasn't just structured like it has always been structured. And I think that we have to take those lessons in. One of the learnings from this project, which really struck me, was that in King County, for instance, for some of the most critical material, translation has always been really hard. But we have translated some of our materials into 30 different languages. And what we learned in the community project with Healthier Here is that wasn't enough. And that there was a greater need to even do more translation, and more importantly, to have those messengers who were there to also explain what was trying to be conveyed. So again, I'll just say, like, I know we've talked about health, like for those of us who've been in this field for a long time, we go back and think about like health in all policies and all of these things. But let's try equity by design in everything and integrate it into our work so that we're not having to do equity as an afterthought.
It kind of takes us back to last year's conference where, John Powell talked about targeted universalism. And so how do we get that intentionality of having a strategy that meets the needs of every community, even if we're in agreement on a goal? We need to have different strategies that work in different communities. I'm going to just like shift gears and just maybe ask you, like, what do you think needs to happen next? There's all these federal dollars sitting out there around COVID recovery. What do you think is the thing that has to happen next, and what's the barrier that might actually keep us from getting to an equitable recovery? So we've dealt with equitable access to testing, equitable access to vaccine. How do we actually get equitable access to recovery?
Well, my thought is that, we need to be working and getting funding to the by and for agencies. Marguerite was talking about trusted messengers. We need to fund them. We can't just expect that they're going to go out there and help. So I think making sure that the dollars are getting targeted towards the agencies that are representing BIPOC and that are BIPOC staffed is huge. We need more of that.
Great, thanks, Leslie.
I mentioned earlier that like a lot of, for marginalized communities, a lot of the funding we receive is like niche specific and doesn't give a whole lot of wiggle room. The flexibility within this funding was fantastic. And so being able to, like Leslie said, get the money and put it in the hands of those people who are actually doing the work and actually getting feedback and can actually give tangible reflective notes about how to move forward and what worked, what didn't work, et cetera, and helping us learn. That's what we need to be doing. And but the government, so.
I'll just say that one of the things that I think we learned is that when we are all focused on one issue, we will move mountains if we have to. That includes creating the flexibility in the policies, for instance, that allowed different areas of our healthcare workforce to come in and be able to provide vaccinations. We created flexible policy. I mean, you see it in the emergency use authorizations, right? That for the vaccines. The question is, what needs to be permanent, right? What are some of the permanent changes that have been made that we need to keep? And then how do we keep that, muscle memory that says, and we can do this when we really care about creating optimal health and equitable conditions. And so I would say, and I know this is not true everywhere in the state, but I'll just say in Washington state overall, we've done a really good job with vaccinations. And we have increasingly been working real hard at making sure that populations who've been more hesitant to get there, we still see gradual improvement. Might be slow, but we're seeing it. Is that we have to stay the course with this goal that we need to have an equitable response. And so I hope we don't lose that as we move into recovery. We said, who are those populations that are most impacted that we must actually, it's understanding like the health of one is the health for the health of all, right? And making sure that we don't lose sight of that.
I was going to read a comment that came in that kind of what somebody is hearing from your presentations is just how much you can actually save if there's investment in whole community prevention, education, and improvements. And that you all are showing how programs can adapt and adjust to meet community needs. So just wanted to give you that reflection back from the audience. It's really fascinating. This may just be a sign that I've raised boys and have a grandson, but I have this vision of the Marvel multiverse, right? That when things happen, you veer off from the timeline that you thought you were on. And I think just in closing, your thoughts about how we don't actually go back to the normal that was January of 2020. Like we have veered off from that level of normal. So how do we actually get to be in front of creating what the new normal is that we want to get to, if we even use that language, so that we don't lose all of the flexibility that came into play in the last couple of years? And if we have to get to more rules and regulation, how do we get them to be moving us to a more equitable set of structures than the ones that we left behind last January? Just any closing thoughts any of you might have on that?
Well, I would just say that, we need to make sure that the people who are funding the work are hearing the stories. They need to hear the difference that was made for so many people, because it needs to be personalized for them. We can't just throw numbers at them and expect that that's going to have any meaningful impact. So I think making sure that we're sharing the stories with them and making sure that we're keeping the pressure on them. You know, we found that this is what worked. So we need to make sure that we continue to advocate for our community's needs.
Thanks, Leslie. KJ or Marguerite?
I know I've been like hyping up Leslie a lot, but you know, long lasting legislative change is what we need. That's ultimately what it is. Through this, we plan to try and rally up all of those partners that we have to apply pressure and, you know, strike while the iron's hot is always a thing I'm thinking about, because COVID is now and is real. And now is the time that legislators are feeling pressure and trying to hear the voices of their people. And so now is the time to rally the folks and try and push for legislative change and holding people accountable. So that's just my final words.
Thank you, KJ.
I think holding a shared vision is really, really important, and helping change is hard. Change is hard. Systems were created for a reason, and systems need to change for a reason. And we need to bring everyone along. And I think that's really true. You know, I'll say one of the things that I enjoyed the most about the project that we worked on was I felt like we were equal partners with community, with Healthier Here, you know, and public health, working all together. We need to create that environment where all of our folks in our different sectors are able to feel like we can work together and share and have that shared vision. And so just want to call out the need for us to help bring people along on that vision.
Great. I think you all actually touched on the question that got raised just a couple of minutes ago about how we can influence messaging quickly. And I think of the panel that came right before us and just wonder if some of it is just getting all of these community leaders that are emerging and helping to elevate their voice. So it's not the same old voices, but it's actually new voices. And how do we create that space for them to lead out of their communities? So just want to thank you, Marguerite, KJ, and Leslie. This has been awesome. Lovely to spend this hour with you, and just appreciate your time. I think, Bonnie, I might be turning it back to you to close us out.
You sure are. Thanks so
Awesome.
much, Liz, and to all of the panelists. Wow, what a great first day today. I was so inspired by all of what Shoma said. I'll remember her tree metaphor in her keynote, thinking about the connections between equity, social determinants, and structural racism. I was really moved by the COVID-19 presentation that we just had, just the incredible response work that's going on in communities and clear calls for systemic change and true community partnership. And also just the Community Voices panel was really powerful, and just hearing the ways that folks are just continuing to move forward, even when it's incredibly hard, and just the value of working so closely with communities. So thank you. Thank you all so much for coming today, for engaging, asking questions, experiencing this with us. We really look forward to seeing you tomorrow at 8:30 a.m. If you missed anything today, don't worry, everything is being recorded. So you will be able to catch those on the ACH website after the third day of the symposium. For tomorrow, we'll start the day discussing and hearing about efforts on social determinants of health. We'll also have a panel specifically focused on youth and a panel featuring tribal partners. We can't wait to see you tomorrow. Have a great afternoon and take care.